when we talk about patriarchy, I think a lot of expectations come along with that as well. So my parents expect a lot from me. Along with that comes things like, why are you crying? You're a strong boy. All of those things, of course, play a huge role in the mental health issues and how men express themselves eventually, even when they are facing some emotional turmoil. And I've gone through it personally as well with my experience with clinical depression.
पूरा लाइफ का स्क्रिप्ट ही ये रहा है that you have to be a provider. I also live with diagnosed anxiety and depression.
Men experience depression very differently than women, and they express it very differently as well. So men show a lot of externalized symptoms such as a lot of anger, a lot of substance abuse, addictions in some cases, hypersexuality, over involvement with work, and these things, they go unnoticed because we think that's just how men are.
Patriarchy normalizes expression of anger from cis men. And nobody else is supposed to be angry.
You're watching Zen-Brain. Let's turn our focus to men today. One of the main reasons for addressing this issue are the number of messages and emails that we've received on Zen-Brain about this. And just for the record, if you look at Zen-Brain analytics on YouTube, close to 80% of all who watch our videos are men. Yes, it was surprising and got us thinking, is it because it's safer for men to watch video content online rather than address mental health issues with a doctor or counselor? And if that is the case, why? Is it because of patriarchy that men are under constant pressure from childhood to man up or be a man and are told things like "Mard ko dard nahi hota" or "Men don't cry"? So when you are indeed faced with mental health issues, and it could be anything from depression, anxiety to serious mental health disorders, could it be that men are actually ashamed of admitting what they are going through? Could that be perhaps one of the major reasons why addiction and suicide rates are higher in men? I've got two men with me today, young mental health professionals, to try and understand mental health issues in men in the Indian context. Let me introduce you to them. Paras Sharma is Director, Programs and Services at The Alternative Story, which is a mental health platform. He holds a master's degree in counseling and is also a doctoral scholar at TIS. And his doctoral research is on body image and masculine identity amongst men. Arjun Gupta had plans of completing his MBBS not once, but twice. But after some serious mental health issues, he chose to instead study psychology. He's soon going to begin his practice and wants to be based in the town he's from, which is Hisar in Haryana. And his dissertation was on men's mental health. So thank you, gentlemen, for being here on Zen-Brain. And let me throw it to both of you. We often talk about patriarchy and how it's responsible for mental health issues in women. But how does it impact mental health in men? Take us through what your experiences have been. Let's start with you, Arjun.
All right, thank you, Shruti, for throwing that question. And to be honest, I did not think that it really affected me. To At the beginning, when I was 17 years old, I did not think patriarchy would be something that affects me. Of course, I'm the favorite gender, so what could possibly go wrong? But when we talk about patriarchy, I think a lot of expectations come along with that as well. So I'm the only son in my family. I have a couple of elder sisters. So my parents expect a lot from me, and they made that pretty clear from my childhood, to be honest. They wanted me to be successful. They wanted me to be a doctor. Of course, I wanted to be a doctor as well. I was very interested in it. But there is a lot of pressure. There are a lot of expectations that come with it. And that is too much to put on, especially for as young a guy I was at the time, 17 years old, and you have the weight of your whole family on your shoulders. You have to pick a career where you're going to earn well, you're going to be taking care of your own family in the future. So I think that starts at a very young age, and along with that comes things like, why are you crying? You're a strong boy. Strong boys don't have to cry. मेरा बच्चा तो शेर है, शेर थोड़ी रोते हैं, शेर तो बस ठीक हो जाते हैं. So I think all of those things, of course, play a huge role in the mental health issues and how men express themselves eventually, even when they are facing some emotional turmoil. And I've gone through it personally as well with my experience with clinical depression. I think it was hugely different because of the expectations that were created on me, that were put on me. And I'm just trying to make a difference for the young men who are out there right now with my work now.
Okay, we're going to come back to you, but I'd like to throw it to now Paras. Paras, tell us what your experience has been.
Similar to, I think, what Arjun said as well. I come from a Punjabi family. I was one of two sons in my family, and I was, growing up, I was the academically gifted child. So एक वो perception create हो जाता है that you're the one who always has to succeed. And family wasn't very well off financially when I was growing up. So all the more added expectation that relatives also putting this thing के जब ये बड़ा होगा then you all will have very good times because this person is going to do big things, going to do good things and things like that. So एक वो perception just gets created, like later on I learned, say technical terms में that in narrative therapy we say case stories which people tell us about us become our stories. We start living those stories, we start playing those characters in our life. So वो बचपन से ही शुरू से ही that tag was there that this is the person who is going to do everything. Like वो I would constantly be told कि तेरा नाम पारस है, पारस जो चीज को छूता है वो सोना हो जाता है, you're the golden boy, you're going to make everything happen. And it just became this thing कि यार you can't fail. And the other thing was also okay, I was growing up very, very close to my mother. So, वो एक तरह से that responsibility also that, oh, now I have to make sure that everything that my mother wants has to come true and everything. And I don't think the impact of that was something that I realized until a few years later after I started working, in fact.
Mhm.
I think तभी जाके पता चला है that all I have learned to do is even just be there for other people and do good. Like I did well, good through school, went through college, did well at the master's level and everything. And I think 2 3 years into working, I hit a really bad bout of burnout, and तभी when I started processing in therapy कि क्या हो रहा है, क्या सीखा है. That is when I started to understand कि यार पूरा life का script ही ये रहा है that you have to be a provider. You have to be the one who has to make everything happen. And to a great extent, I was able to do it. Like, I had a good job. I was supporting the family
Mm.
financially, emotionally, and everything. But I realized that if something is going on in my head, I don't know if I am able to open up and talk to anybody about it. And here I am as a therapist talking to people. I'm supervising other therapists who are talking to other people, yet I don't know how to open up and talk about my own stuff to another person. And I also live with diagnosed anxiety and depression, and I discovered last year that I also live with obstructive sleep apnea, which I discovered through years of being fatigued. But वो एक तरह से normalize हो जाता है that to feel anxious, to feel tired is just part of it. ये तो मतलब होता ही है. You just power your way through it, and I think after a while it just catches up with you. I found it thoda aisa funny when you said young mental health professional. I do not feel young at all. I think just the fact that it took me so long to even realize that nahi, it's not normal to feel tired all the time, sad all the time, anxious all the time. Just talks about how much patriarchy just puts on as a load, and then you start living those stories. You become those stories.
Very interesting what you talked about, this narrative therapy. Arjun, you've had a fairly happy childhood, supportive parents. You made it through to medical college, which is a big deal in India. You were getting decent grades. You had no history of any mental health issues. And then something happened. You began to spiral. Tell us exactly what happened.
I was in a perfect place academically. I was in the college I wanted to be in. I had great friends. My family was very supportive. I was in the stream I wanted to be in. I was going to fulfill all my dreams. And all of a sudden I start thinking very negatively. I start noticing that I'm very pessimistic about my life. People would come and tell me, congratulate me about my future as a doctor, and I'm just like, yeah, but doctors are miserable. Who's a happy doctor? Show me a happy doctor. I'll tell you how sad they are. And that eventually started becoming a part of my life, becoming a part of my identity, that I was just very pessimistic. पूरे time ही ऐसे नेगेटिव थॉट्स ही रहते थे. आई वुडंट टॉक टू पीपल क्योंकि लोग तो छोड़ ही देते हैं, तो फिर उनसे बात करने का फायदा ही क्या है. आई वुडंट इंटरेक्ट विद देम. आई वुडंट इवन स्टार्ट न्यू कॉन्वर्सेशंस कि इट्स गोइंग टू एंड एंड इट्स गोइंग टू हर्ट एंड देर गोइंग टू गो अवे. तो क्यों करना कुछ भी. And the next thing I knew, I found it difficult to even attend my classes. I found it difficult to think. I found it difficult to write, read. And a few months later, I was having thoughts of suicide, and it all just happened so quickly. I had no idea how it happened, why it happened, and the most frustrating thing was it is still that I don't know why,
Yes.
and that's scary as well because it happened for no reason.
Exactly.
Yeah.
So I'm going to interrupt you here because kids, and I wouldn't just say the men, but young adults per se, start feeling this sense of feeling extremely low during that phase. And of course, a lot of brain researchers have also talked about how the brain is developing at that time, how perhaps mental health issues actually come to the forefront at that period as well, right? For you specifically, you started self-harming and you had suicidal thoughts at that time, and you didn't have a history of any mental health issues in the past, so you didn't know what to expect. How did you handle that?
I did not handle it at all. I did nothing. I just dug deeper and deeper कि कितना ही खराब हो जाएगा. What's the worst that could happen, right? But it was my parents who actually put a stop there and said कि बेटा, this is not normal for you. तेरे को इतना गुस्सा नहीं आता था, तू इतना शांत नहीं रहता था, तूने हंसना ही छोड़ दिया. And that's when they said, ki, let's go to a psychiatrist. Let's visit a psychiatrist and see how it goes. So I think if there had been no intervention from my parents at that point, I'm not sure how deep I would have gone without anything. And that's when I decided to cooperate with them and said कि चलो ठीक है देख लेते हैं क्या होता है psychiatrist के पास. So we went to a psychiatrist and they gave me some antidepressants and sleep medications. But a 17-year-old boy living in a tier 3 city, तो ये medication का तो यही डर रहता है कि it will make you gain a lot of weight, it will get you addicted and whatnot. So I did not take medications either. I think there was a lot of resistance on my end personally, but thankfully my parents were very supportive and very insistent that I get the help I need.
So, Paris, tell us what your experience has been like working with young males like Arjun, where you don't really have a history of any sort of massive trauma that he has been through. And so you're not able to explain it, to anyone, like, why are you going through? And occasionally I have been told by youngsters that we are told to focus on the positive and how much you have, and instead of focusing on what you don't have and what you're going through. But how should a young boy or young girl in this context handle things?
I think just this condition that something really bad or something traumatic should have happened to you, and then and only then it justifies being anxious or depressed in itself, is putting like such a high barrier for entry for diagnosis itself. नहीं होता है. I think sometimes it's just biology. Sometimes there is a traumatic incident which is a trigger, but the vulnerability was always there, right? And sometimes neither of them are visibly there, and still it happens. So I really don't think that we should even get into this root cause analysis, because there's never going to be one thing that anybody, any mental health professional or any person who's surviving mental illness is going to be able to pinpoint and identify कि ये point से my life started to go into depression or anxiety or whatever. So that's one thing. I mean, as Arjun said earlier, I think you need to look at your normal, and apne normal say whatever deviations that you see which you feel are significant. Whether you're feeling more angry than usual, whether you're feeling sadder than usual, whether you're feeling more restless than usual, whether you're feeling completely devoid of any energy than usual, whatever is the usual for you. And कुछ भी ऐसा justifiable explanation नहीं है, like a physical illness going on or a particularly stressful period going on in your life. I think that is something that we need to address, even if there is something which is not quote unquote wrong with us.
What can a person do at that time?
I think at that point in time, taking it seriously and knowing that we don't have to make this comparison, okay, it is not that bad because there is no benchmark like that bad.
Yeah.
There's no 12.5 is the normal hemoglobin. So if it is falling below that, then it is bad. So there's no that bad when it comes to
Mhm.
mental health. It is always whatever is your threshold above or below that, whatever is that deviation, and it's a significant period of time. And usual जो coping abilities है अपनी उसको use करने के बाद भी if you're not able to do anything, if the things are not improving or it's taking all of our energies to just go through our usual activities, you know, it shouldn't be a struggle. I
Mm.
think we are uh, taught and we are raised to glorify struggling and feeling difficult. It shouldn't be like it shouldn't be a traumatic, difficult, stressful experience
Mm.
all of the time. No, we
Yeah.
should be able to go through everyday things without feeling, an inordinate amount of sadness or anxiety or fear. So I think that is the thing. It's never about comparing with some, I say, imaginary standard or bar and saying that once it gets this bad, only then you should think
Mm.
about it.
Mm.
No? So take it seriously and talk to a therapist. You have nothing to lose, is what I definitely would say. But that's also a complicated uh, suggestion to make because you know the availability of a therapist. Forget a good therapist. That's a therapist. Availability of a therapist. Period is very very difficult. In our country. So it's a multifaceted problem. If you
Mm.
can't make one suggestion, because that suggestion in itself will open up another Pandora's box of problems, because it's not that services itni sari padi hai and it's so easy and so affordable and so accessible, बस जाके उसको लेना है. That's not what the case is in our country.
Mm. But one of the
So
suggestions that we always make, in whatever discussions that we have, is that if you are hesitating from seeing a professional, at least seek out somebody within your friend circle, somebody you can speak to, either a relative, an elder person, whoever it is. Reach out and explain this problem to them, and make sure that you reach out to somebody who knows what is happening, if you're unable to talk to your family member. And I'm sure other people can help get through to somebody else, maybe a medical practitioner, maybe it could be just a doctor. But then again, like you said, there are multiple layers to that. I want to ask you something, Arjun. You talked about medication, right? And that you did not take the medication for a number of months, and then you hit a real low, and then you took it. And it's the point that I want to make here is that not always does medication work the first time, right? It does sometimes, but many times it doesn't. And if so, you need to get back to the doctor and explain to him why it's not working. They will tweak the medicines. And this is a very, very crucial phase, because you're low and because the medicine doesn't seem to be working, you hit a new low. What do you think somebody in your position could do?
This is one of the toughest things to accept about psychiatry, because otherwise, when you look at other branches of medicine, whether it's a general physician or something like that, if you have a fever, you get a paracetamol or a crocin, right? And it will work eventually. You don't have to worry about it. And if it's not working, it's maybe something different than a viral fever or something normal like that. Like in psychiatry, you need to be a very active participant in your own treatment, and we're not used to that. We're not used to giving feedback to our doctors. We are not used to telling our doctor कि हमें ये नहीं चाहिए, ये चाहिए, हम this इससे हमें ये reaction हुआ तो फिर आप कोई और दवाई दे दो. It is a very one way communication that we're used to with doctors, कि आप जाओगे वो आपको दवाई दे देंगे और फिर ठीक होना आपकी जिम्मेदारी.
Mm-hmm.
So I think in that situation, when you're in that phase, first of all, if you're able to overcome the stigma, which I was not for a very long time, irritatingly long time in hindsight, it's that you have to be responsive to your psychiatrist. You have to tell them what you want, what you don't want, what is working so far, what is not working. And it has to be an open communication. Of course, the psychiatrist has to be receptive as well. A lot of psychiatrists are like, हमने तो दे दी, आप देख लो, अब आप पे नहीं चल रही तो आपकी गलती है. So there's a lack of training on that their end as well. कि psychiatrists are not always very empathic to their patients. That if it's something's not working for you, then maybe we can change something. So I think it's again a very complex problem. Psychiatry is a very different field than the other fields of medicine, and I think if the psychiatrist is able to form that relationship with the patient and the patient is a part of that, then I think it's way more productive for everyone involved than just one-way communication.
Brought out a very, very important point and very crucial for people to understand that you need to be an active participant in your own therapy, in your own process of getting over an illness. And sometimes even a therapist may not really click with you, and it's okay to say, this doesn't work for me and move on to maybe experimenting with another. It's tough. And especially at that critical phase where you are at that lowest of your low, it is very, very difficult to think straight and look at alternatives. I really want you to tell us what your experience has been with medication, with therapy, and how you've managed to get back on track, and the diagnosis also.
With medication, as I said, I took them very late. And when I did, I was not very active in my responses to the psychiatrist either. मैं उनको बताता नहीं था कि इससे कुछ बेटर हो रहा है या नहीं हो रहा है, इससे ज़्यादा नींद आ रही है, कम आ रही है. I was just कि ठीक है, आप ये ट्राई कर लो, अब ये ट्राई कर लो. And my parents had to be the one to tell my doctor this one made him a bit more sleepy, this one made him smile a bit, so maybe this one is working. And I was again a very, very passive participant through all of that. So I think that all changed when things got so bad that electroconvulsive therapy, I was recommended electroconvulsive therapy, and that is what had some effect. Because that completely takes you out of the equation. उसके बाद तो आपको कुछ करने की भी जरूरत नहीं है. And I wrote this whole Facebook post about how I'm going through a lot and I'm struggling a lot with clinical depression. And people were very understanding. People were very supportive in my city, my teachers, my juniors, my friends. And that's when I realized, okay, this is something that is not my fault or something that's wrong with me and something that's wrong with my character. This is an illness. And for an illness, you need to take the treatment and you need to participate in that as well. मतलब ऐसे अपने आप जादू की झड़ी नहीं चलेगी कि कुछ हो गया और फिर ठीक हो गए. So I think that's when I started being more open with my psychiatrist as well. And who would have thought 3 months I was very much better, just because I was more open with my psychiatrist. I was more honest with them. With therapy, as you said, I think in the last few months I've gone through 4 therapists right now because I'm not being able to find the right one. Even then I struggled a bit to find the right one because you need to have the right fitting with them. मतलब एक vibe आनी चाहिए to use the Gen Z word. So yeah, it is a tough process. It is something that takes a lot out of you. And each time you try to look at a new therapist, you think कि यार मेरे साथ ही कुछ गड़बड़ है कि इसके साथ भी नहीं बना, इसके साथ भी नहीं बना. Maybe something is very wrong with me, but that's not how it is. You're just part of a puzzle and you have to find the one that fits you, and not everyone will. So that's completely okay. And getting back on track, I think that Facebook post changed things for me. That's when I started being more open, being more honest, and being more accepting of what I was going through. And I think that is genuinely the turning point in my life, looking back 5 years ago.
Interesting you say that, because a lot of people criticize social media, and I think one of the things that social media has really done is really encourage vulnerability. And when one person is vulnerable, others somehow develop the courage to become more vulnerable and feel like, okay, they, what they're going through is not exceptional and is okay. It's okay to be going through what they are. Paras, I want you to step in.
I think one of the reasons why a lot of times people hesitate to come to therapy or don't stay in therapy after they have started is because of this conditioning of this one-way communication wali relationship with a medical professional. People don't come to mental health professionals with expectations which are different from what they have from a medical professional. So when you are expected to be an active part, even much more active part in therapy than in psychiatry. um, when people come for a therapy session and they realize that अरे यहाँ तो पूरी मुझको ही बात करनी है, वो तो सिर्फ सुन रहे थे 1 घंटा और कुछ बोला नहीं, कोई कोई सोल्यूशन ही नहीं दिया आपने, तो सो दे स्टार्ट फीलिंग ये तो मुझे ही बात भी मुझे ही करनी है, सोल्यूशन भी मुझे ही ढूंढना है, आप सिर्फ सुनोगे तो ये तो मतलब कोई भी कर सकता है. That common misconception ना कि I was just watching उस दिन, एक there was a reel के one young person was asked कि what is the most useless degree, तो उसने बोला कि psychology सबसे फालतू बकवास डिग्री वही है. 1 घंटा they will listen to you, anybody can listen to that, and what is the big deal in doing that? So I realize that there's a conditioning that people have ke where are the answers, where are you giving us answers, and it's a slow process, it's a methodical process, and it's also a process jahan pe uh, as Arjun said, you will not always find a good fit, uh, but finding that fit is also such a big task in a country as diverse as ours. There is a lot of pessimism and mistrust. So, एक वो भी है that people will often look down on therapy. They think कि ये तो कुछ नहीं हो रहा है. There's no medication. There's no solution. So what is it that we are exactly doing? I think when it comes to mental health, my family is a typical Indian family which is in complete denial of the fact that mental health is a serious issue, full on stigma about mental illness. I haven't told my family about the fact that I have a diagnosis for mental illness. I can't talk to my family about chronic illness. I can't talk to my family about. They know that I go to therapy, but they think that इसके लिए है because all counselors have to go for supervision and therapy. वो हिसाब से है. And I'll have my mother, I'll have my relatives talk to me about things which are बहुत ही clearly typical anxiety depression presentation, and the question will be हम पागल तो नहीं हो रहे ना, हमें ठीक तो होगा, दवाई तो नहीं लेनी पड़ेगी ना, साइकाइट्रिस्ट को पास तो नहीं जाना पड़ेगा ना. They want the reassurance from a psychologist, but they also want to then be dismissive. अगर हम लोग बोले कि I think this is severe enough and you would benefit from medication. I've had relatives come back and say, "वो doctor थोड़ी है that he is recommending that I should go see a psychiatrist or a medical professional." And they'll go to, like, we are very good in India to go out and find doctors which will give us the advice that we want to hear also quite often.
I think we should come back to the topic that we are discussing today, which is mental health for men. And, Arjun, your dissertation was on mental health for men.
Men experience depression very differently than women, and they express it very differently as well. So men show a lot of externalized symptoms such as a lot of anger, a lot of substance abuse, addictions in some cases, hypersexuality, over involvement with work, and these things, they go unnoticed because we think that's just how men are. If someone is putting in too much work, if they're focusing too much on their career, or they're getting too angry, or they're drinking a bit more than usual, that's just how men are. Maybe they're stressed, maybe they're just trying to drink compress, but what is really going on is a very serious case of depression, which sometimes goes unnoticed.
Arjun, you were talking about how men express whatever they're going through in various ways, which is different from women, right? One of the things that you said is anger. So just tell us a little bit about that, and with your personal experience as well. And, if somebody is definitely going through something similar, then what can they do?
I think anger plays a very central role when men are going through depression. And the thing is, psychiatrists or mental health professionals in general don't identify it as a symptom of clinical depression. उनको लगता है कि this is a symptom of psychosis or schizophrenia or bipolar disorder. So due to my anger, I got all these litany of different diagnoses from different doctors कि psychotic depression होगी, ये होगा, वो होगा. But anger was genuinely the only way I could express all that energy I had inside me. So I'd throw things, or I'd punch some walls. The fridge at my home still has a lot of dents from my punches,
Wow.
and that is how it all went out in a way that did not end up hurting me, at least a lot. So I think when you're feeling that anger, which is more than usual, it looks like frustration, irritation, and it does not seem to have any cause at all. It's very unformed energy inside you that you just want to let out. I think in that moment you have to let it out. Either it's in form of physical exercise or any form of energy expending that you can do. So I started exercising a lot more. So I used to have a very fit, very fixed routine of exercising beforehand as well, even when I was going through that phase of clinical depression. But after that, I just pumped it up a notch because I wanted to let that anger out. So any form of activity that makes you express that energy in ways that are not destructive, at least at the minimum, is a good way to express it. ठीक है, it's not going to be the end all be all. The anger will come back, and for that you need to work with a therapist or with a psychiatrist, whoever you deem best. But in that moment, if you're feeling that angry, just let it out.
So repressed anger. Paras, let me come to you. This repressed anger, could this be one of the major reasons for the number of suicides that we see amongst men, that addiction cases where men are more addicted than women?
I mean, it's not always repressed anger because if anybody in our society has the license to be angry, it's this men, you know.
Why is
So
that
it's not
again?
all because patriarchy, because patriarchy normalizes expression of anger from cis men, and nobody else is supposed to be angry. I mean, women are not supposed to be angry. Children are never supposed to express any kind of anger. Persons of genders other than cis male are always expected to play their different roles in society. Only young cis men have the angry young man persona, which is allowed to them.
Toxic
बिल्कुल बिल्कुल
masculinity that we
yes
talk about, right?
yes
It's almost
yes yes
normalized in our society. And, I'd just like to add one more thing. I think women also play a very incredible role, an important role in pushing this perception, that we want our men to be a little strong. We don't want to see them crying. It sort of bothers us if that happens.
My research talks about development of body image and masculine identity. In the masculine identity side of things, especially, what I've realized is that some of the agents of masculine socialization, it starts even before school. So if you grew up around men most often, there's a much stronger, in my at least research findings, much stronger likelihood that you will be raised in more traditionally masculine ways. If you are in a boys' school, you will be exposed to much stronger patriarchal ideas. I found that in STEM disciplines, especially if one was living in a residential hostel during their college years, much stronger socialization in traditional masculine roles, because अगर वो नहीं play करो roles, you don't fit in into those contexts. So there's a lot of bullying, a lot of ridiculing जो होता है, because if anybody is straying away from those set masculine norms. So a lot of it is not just anger repressed, a lot of it is also because of shame, and you think, I will never fit into the society. A lot of it is also disappointment and guilt of not being this ideal male figure that society wants me to be. So the hopelessness, the sense of I'm a misfit, I am unpopular, I am unattractive, is also one of the reasons why a lot of people feel down. I think that is something which is always there. And if you have the alpha male, that alpha male stays as the alpha male by keeping a majority of people down. So जो उसकी वजह से people are also treated badly, ridiculed, mocked, which again we normalize because we think, hey, that person has earned that right. If I'm in a college hostel and my senior is ragging me, then that person has earned that right. If my boss is swearing at me, treating me like garbage, then that person has earned that, and the aspiration becomes, okay, I have to take that place, eventually. Not that this culture in itself is wrong. It's not just repressed culture, it's the repressed anger, it's the normalization of this culture that men are supposed to treat other men and other people in general like trash. And it is okay because they have earned that right somehow. And however you have to cope with that system, however you have to cope with this world, whether it is through overworking, whether it is through substance use, whether it is through risk-taking behavior, or whatever it is, you just have to try your best to try and succeed in this world. And when you find that those opportunities, that success is never going to be possible for you, there's a lot of that. There's a lot of depression. There's a lot of disappointment that happens because of this. Repressed anger is one of those factors, but feelings of disappointment, feelings of defeat, feelings of loss, feelings of shame, which we have no instruction manual on how to process as men. I
Yeah.
think that is something that we talk about. Like everybody talks about getting into the IITs. Nobody talks about how do you move on if you don't make it to IIT. Everybody talks about clearing the NEET, and nobody talks about what to do if you don't clear the NEET. Everybody talks about UPSC. You don't get into UPSC, फिर क्या होगा आगे? We don't talk about the other side of it at all. It is like you do this or you are just you don't matter.
You're useless basically if you don't do
Yeah,
it.
yeah.
It's funny, every time I speak to somebody who are from any of these elite institutes, um, they all have this to say, that nobody knows what happens after you get there. It's almost like you complete, you almost reach a level of completion once you enter that particular college, right? Getting into an IIT or any of the medical institutes. And what happens after is the beginning, just the
Yeah.
beginning of your journey. And many people falter and they're not able to understand what happened because they've reached where they were supposed to, right? Now what? And then when you start feeling bad and feeling low and having these mental health issues, nobody around you is also able to explain why. Sab cheez to theek hai. Sab cheez theek hua. You got through, right? Now, the other thing, the sense that I get from you, Paras, is that when you're not able to cope with things, you turn to, perhaps alcohol, you turn to addiction. So, which means developing coping skills. Is that something that we should be looking at going ahead in future, as far as men are concerned and women, coping
Mm.
skills, because we aren't able.
Um, yeah. So I think I take a different approach to it. That's why the organization that I founded is also called the Alternative Story. Uh, there's an entire discipline of psychology which is focused on what you are saying, developing coping skills, positive psychology we call it. And all of these branches of psychology have one criticism in common. Okay, they are making the responsibility a completely individual responsibility. In this discussion itself, ना अगर हम लोग देखें तो we are talking about, oh, you have to find the mental health professional, you have to persist, you have to be the active participant, you have to develop the coping strategies also. What I think, and this is not my approach, this is the approach that I've described to, is what we call as psychosocial approach, which means uh, a person is a product of the society or the context in which they are living. So, bad mental health in a majority of young people is cannot be an individual issue. It has to be a product of a culture which is producing bad mental health in those people, right? तो अगर हम लोग बोल लें कि coping strategies अच्छे develop कर लो and you will be able to face this, we are saying at one point that it's a given that the environment is going to be toxic and we have to somehow shield ourselves from being toxic, which then is absolving the environment, the context from any responsibility. I think we have to talk about what are we doing in our society. So एक मतलब चीज which I always love to quote is 2014, I think WHO came out with a report on global suicides. And usme they had a very interesting finding, which they said that in all parts of the world, 90% of deaths by suicide could be attributed to a diagnosed or a diagnosable and treatable mental illness. They said that that figure is not applicable to two countries in the world, one of which is India, the other one is China. And they say that in India, 60% of them we could probably attribute it to mental health. But 40% of suicides in India and China are a consequence of the unique psychosocial factors in these two countries. So, matlab, what I want to say is that if we look at the reasons which are cited post facto for why somebody died by suicide, you will see that it's a cross section of all the issues which are wrong with our society. No, in suicides in India, a lot of suicides in India are not even a mental health issue. They're an economic issue, or they are an issue of discrimination, whether that's on the basis of caste, whether that's on the basis of gender identity, sexual orientation, religion, any of those things, or I mean, economic issues are a huge factor in terms of our society. So I definitely want to say that coping in all of that is like saying, okay, if there is a COVID wave out there, and you're saying that get a better mask, have these immune boosters and things like that, will they help? Sure, they'll help, and then you should do what you can to improve your own immunity and your own protection against something. But ultimately, if you are in a toxic environment, unless we fix that toxic environment, we are going to continue producing larger and larger numbers of people with worse mental health.
Yeah.
So I think it also talks about the fact that a lot of the toxic culture, the toxic patriarchal culture, masculine culture, casteist culture that we have in our country, if it is not remedied, that's not going to get any better.
Mm.
And I think it comes down to a lot of that. I definitely do think uh, these are not issues which are separate from mental health. आई डेफिनेटली थिंक कि ये सारे इश्यूज मेंटल हेल्थ के साथ कनेक्टेड है बिकॉज रिसर्च ऑल्सो शोज के पीपल हु आर फ्रॉम marginalized backgrounds in our society, whether it's people who are of oppressed caste, whether it's people from minority religions, whether it's people who are from conflict affected parts of our country, whether it's the LGBT community in our country, all of them have significantly higher rates of suicides, depression, anxiety uh, amongst them, especially amongst their 14 to 29-year-old population, than the average population.
Mm.
And of course, India as a whole has higher rates than the global average when it comes to depression, when it comes to suicide anyway.
That's right.
So that connection na, जो है between different kinds of marginalizations, which are down to the psychosocial realities of India, and its connection to mental health cannot be overlooked at all. I think that's something that I strongly believe in.
Absolutely. And it's a very, very valid point, Paras. We can only try one step at a time. And that's really our aim. The three most important aspects of mental health related to men. Arjun, what would the 3 points be?
I think the first would be something I tell all men I come across is to learn more emotion words. So when I was 17 years old, I had four emotions. I was sad, angry, happy, or normal. मेरे और कुछ इमोशन होता ही नहीं था मेरे लिए. मतलब those were the only emotions that existed. But since I've started reading a lot more, I've started writing a lot more. I know a lot of different emotions now. So there's this emotion wheel that is available online that you can use to learn a new emotion word. And I use that a lot with my students as well. कि when they are confused about what they're feeling, I just show them the chart कि इसमें से देख लो तुम्हें क्या which word feels right for you. And hopefully we're trying to build one for local languages as well in India ताकि we don't have to rely on English. So hopefully that comes together soon. So first, improve your emotional vocabulary. Secondly, I think if we're focusing on men's mental health, so we don't really want to talk about it. We don't want to tell it to someone else. So what I personally do sometimes, I write it on a piece of paper, what I'm thinking about myself, if it's very negative, and either I tear away that paper or burn it away or flush it down the toilet. I should not be doing the last one. So that just lets it out for me कि ठीक है मैंने कहीं पे निकाल के उसे फेंक दिया कि it's not I was vulnerable for a moment and I don't have to fear it being seen by someone else as well कि कोई और पढ़ लेगा और फिर उनको पता चल जाएगा. Lastly, I think the most important thing is that these things are normal. These things are just part of human nature, and it's not realistic to think कि men will always be strong and happy and successful and always growing from one place to another. There will be roadblocks always, and it's okay to slow down every once in a while. And I encourage a lot of my male clients or students to just slow down and see where they are at this moment.
Mm-hmm. Paris?
One thing I would definitely say is try to identify yourself and other people in your life as individuals, not representative of different categories or like especially gender categories, because wahan se a lot of these toxic ideas start. So if we start looking at ourselves as individuals and not people who have to fit into a certain category, we normalize the idea that it is okay for people to be different in every way. Not everyone will cope with things in the same way. Not everyone will experience the same kind of mental health and mental well-being all of the time, and it is okay for everybody to express and experience all kinds of experiences and emotions. And it's not that certain experiences and emotions are reserved for a particular gender and others are forbidden. So एक वो है. I think allyship and being better people to the important people in our lives is a very important thing. I think for me, uh, I think just the fact that to understand the struggles that, say, the women in my life go through, or my, people. I mean, I'm a Savarn cis man, so to understand what people who are not Savarn or not cis or not het would go through helps me be a better friend, be a better partner, be a better ally to people. I think that makes at least as an individual, then I can be a source of validation, a source of support for them. So it's not, I'm not saying a social change wali baat hai, that it's a macro issue. I think, one of the takeaways from feminist therapy for me is personal is political. Okay, if you are able to change something at your individual level also, if you are a good ally, if you're a good partner, if you're a good brother, if you're a good friend, you're a good colleague, a good boss to people, you already are having a ripple effect on the mental health of a lot of people. So I think as men, I think I feel I have to uh, I'm not going to say role model, but I at least have to unlearn a lot of the behaviors and learn a lot of behaviors, which will then normalize that for other people. The third thing I want to also definitely say is when it comes to substance use, if that's your only way to cope with everything that's going wrong, whether it's anger, whether it's sadness, whether it's grief, then it just becomes like a staple in your life. That whenever I feel thoda sa bhi off, that becomes the thing, and that makes us very, very dependent on it. So find other ways of expressing these emotions rather than just आज दोस्त थोड़ा उदास है तो उसको लेके चलो and we will sit and drink. As somebody had a breakup today, let's binge drink. Every time that can't be the response. So I think that is the thing, and learning different ways of doing that is again a very, very important thing, especially amongst men.
There's so much to discuss. But just to wrap up, Arjun, if there are young boys, young men watching who may be going through perhaps what you went through when you were 18, right? What is the advice that you have for them?
The most important advice I can give them is to take control of what they're going through. I mean it in the sense that we think that there will be a savior that will come in and heal us. We end up looking for inspiration outside of us. Motivational videos, I'm not sure that is how it will happen. Make a decision for yourself. I used to look for inspiration on YouTube कि कोई न कोई किसी की story ऐसी मिल जाएगी मेरे को who's going through the same thing and what he did I will do as well. But that person will have their own life now. They have their own context that they came from. I am a very different person than them, and if I keep looking for inspiration from somewhere else, I won't get it. Of course, that is why a lot of motivational speakers आजकल उनकी दुकान इसी basis पे चलती है कि they they can give you motivation that will last for long, but it goes away in a few days. It doesn't last.
Take control of your life. Very, very important in any kind of illness, in anything that you're going through in life. Take control. Paras, one last word.
I think I'll address the other extreme of that. Like I said, I grew up with this notion that I am the one who's going to solve everything. I am the one who's going to make everything okay for my family, for my mother. No person at the age of 16, 17, 18 should feel like, when I'm 25, I will do this. When I'm 30, I will like pay off these debts and I will bring my family out of this and all of that. I think, all of the answers also will not come from you. And I think nobody should have that kind of a responsibility, that it's okay to fail also, it's okay to seek help also, and it's okay to say, okay, I don't know. Not having all of the answers, not being able to be there for everybody, not being able to provide and make life better for everybody is also okay. Like I think I'm still learning to do that, but I think now I'm at least able to say कि अगर मैं खुद का ख्याल रखूं and I can manage to feed myself and clothe myself and get rest and take care of myself, that is something. Because we are constantly conditioned to be these kinds of, larger than life, superhuman men as well. So there's nothing wrong if you can't be that, and don't think that all the weight of this world is on your shoulders.
Well, I know that Arjun, you continue to work in the area of mental health for men, and you actually invite people on your LinkedIn to come and reach out to you if they're going through anything that they'd like to discuss, and it's a safe space. And I know, Paras, you do that too. Guys, anybody watching who would like to get in touch with them directly, we will put their contact details below so you can reach out to them. So thank you, gentlemen, for joining me on this discussion. Like I said, there's so much more to discuss, and this is just the first step. And I hope to have you back soon to have a part 2 on this. So thank you both.